So basically, in today's class, the agenda is to start the different types of letter. So as yesterday, we discussed about three different types of letter. A letter when we have the diagnosis given. Let's say, as you can see, a letter when we have the diagnosis given, right? For example, we also have discussed a letter when we don't have the diagnosis. Let's say here, you can see that there is no diagnosis given. So we also discussed the differential diagnosis as per the yesterday's class, if you remember, right? These are the DDs that we discussed in the yesterday class quickly. So in today's class, majorly we'll be discussing about the letter of discharge, but not that one, a conventional discharge, but we'll be discussing majorly about the letter of discharge, about the types of letter. These are not the complete writing tasks. These are just the, basic details, so that we'll try to understand like how we can write it down, the letter of discharge. So in case of writing a letter of discharge, we can see that here the patient was admitted with schizophrenia. He was managed. Obviously, there are a lot of details in the hospital. And we are writing this letter to the primary care physician. If you're writing this letter to primary care physician, then the past history or social history will not be relevant if you're writing this letter to the primary care physician, right? Is it clear to you? So moving on, we can see that a letter of discharge can be having the guideline for the follow-up and just the update in the letter of discharge. So these are some of the examples that when we are writing a letter of discharge, it's a kind of referral back to the primary care physician. Past history is irrelevant. Whatever the, you can say, task of follow-up, it is important to expand it. So, but before we can move on, as I will be discussing a letter of discharge with you, so I'll be discussing few cases. Let's say if there is a patient, just to make a demonstrative case, his name is Mr. Smith. His age is 68. He's quite active person socially. He used to walk 50 minutes a day. He was diagnosed with osteoarthritis 2 years back, for example. And recently, he underwent a successful right knee replacement surgery. His stay in the ward was of 10 days. Let's say it was uneventful, like there was nothing significant. It was uneventful. And she was widely stable and good circulation on pillow. Let's say these are things that has been written in his ward stay. Then we have the rehabilitation. In the rehabilitation, the patient remains for 6 days. Then we have some techniques for the rehabilitation, such as you could say gentle exercises, frame or shake, and so on, right? Okay. So you can see that now this is a letter of discharge. We can expect in a conventional way. What I mean by the conventional may mean when we are a doctor, a specialist, and we are writing this letter back to the GP. So GP has to ensure the follow-up plan. Let's say this is a discharge plan that has to be ensured by the GP. So you can see that in the rehabilitation, almost we could have the same thing such as exercises, whatever the exercises that has been written, such as you can say use of frame, for example. Now, if you can see in the discharge plan, we could also have the same thing. You can also have the exercises and so on. So in a conventional letter of discharge, we can follow the sequence of events. However, let's say if you are writing this letter, the same letter after hip replacement, to the social worker. Okay, first of all, we are writing this letter to a social worker, let's say, for the sake of argument. we have a lettering task, and we can say that write a letter of referral to social worker. I just have written the socioeconomic details for the understanding purposes, but the task will be write a letter of referral to a social worker. So we can change a few things in this social worker letter. So for example, over here, they would also mention maybe, let's say, on day 4th, patient develop depression. Hospital required. Okay. So let's say on day 4th, patient developed depression that was hospital required. And we can also write down he's depressed at the time of discharge. So the patient is also depressed at the time of discharge. Now, what we are doing, we are writing this letter to a social worker, let's say, and request him to help your request. Okay. So we can see that write a referral letter to the social worker to help the patient to resume normal life, right? Now, this is your writing a referral letter to the social worker, right? So if you can see there, now what would be the introduction of the writing task that we discussed? If this is the case, the patient had right knee surgery, and now it's not a conventional but unconventional discharge. You are discharging the patient, but they have written a referral letter to social worker to help the patient resume his normal life. So what would you write in the introduction? How can you write down the introduction? So let's say, to make it clear, we can write it down in the introduction. I will just tell you. Now this is your, basically, as we discussed that with reference to the last discussion in a few minutes before, we have to use this as a statement. I'm writing to require your social services for Mr. XYZ, who had developed depression during his post-operative ward and rehab management. I would therefore appreciate if you could assess the patient and help him to resume normal life. Okay. So let's say if you will be writing this letter to the social worker, we can write it down in this approach. The common mistake candidates can do, they can write it down. This is the introduction. I have written two introduction. The one is most appropriate introduction, then the second one is the mistake the candidates do just because they try to follow a pattern, right? So this introduction in view of the social worker, it's right. This one, I'll try to make it more clear. I don't know. This is appropriate. However, in this introduction, your focus is not clear. So if you write it down, the introduction in this approach, I'm writing to refer Mr. X, who has undergone a successful writing replacement and is being discharged today. You can see in the first sentence, your reason of writing is not clear. In comparison to this introduction, where we can see that we have a clear reason of writing. The social services is being demanded for the patient. Why? Because the patient had developed depression. The second thing, and I would therefore appreciate if you could assess the patient to resume his normal life. The third thing. So the first introduction is more clear with a clear focus in mind. So I hope it's clear to you. And you can see that socioeconomic history in this case will be more important. Obviously, we are going to make the landing approach so that we can move on toward the, you can say, the task. So we have to write it down, the socioeconomic history in priority. It would be more important to write it down as compared to the conventional discharge, when we won't have, even like say in the conventional discharge, we are writing this letter back to the primary care physician. So in this regard, like socioeconomic details are not important. So for that reason, it is sometimes challenging for us to understand how would we write it down, the unconventional discharge letter, when we have to write it down to the like allied professionals. We can have such letter in the category of referral, like just it's not a discharge, but it's a category of referral as well. Anyhow, the second case that we can discuss in this class today, now with the same history, that we discuss, if we are writing this letter to the occupational therapist, so we have to see there might be some information that we have to change in the discharge letter, as I mentioned over here. So in the discharge letter, we can have some information, additional one. I'm just writing with the strict frame. So we can add the assistive devices, for example. We can add the RAM, for example. We can add the, for example, bed drills. Right? And yeah, we can write these things in the letter, and the writing task would be changed in case of occupational therapist. What we can write as a writing task? Now I will be writing this thing again for you. This is your occupational therapist. We are writing for the home assessment after his discharge. And if you are writing this letter to the occupational therapist for the, we can say for the workplace assessment, we can simply write it down in this way. This for the workplace assessment and for the, we can say home assessment, right? So we can write it down. We can write it down in this way, right? So you can see that these are two different introduction that we can write it down. So we have to see for the occupational therapist, we can write it down for the home assessment and for the workplace assessment. In this regard, these are some different introduction we are discussing. Followed by the, if you are writing this letter to the pension care, you can write it down. I'm writing regarding Mr. Alex, who needs to be, let's say, who needs to be evaluated regarding his eligibility of pensions, since he has lost all of his investment recently. After his successful rehab management, he will be discharged. However, pension is quite anxious regarding his financial or rehab management. You can also add the knee replacement over here. Anyhow, so these are a few different types of unconventional discharge letter that we discussed with you. So before we can proceed further, if you like to